Hey guys, how's it going? This is FixerMed. Welcome back to my high yield anatomy review series for the USMLE Step 1 NBME CBSE and NBME CAS examinations. This will be part 26 of my multi-part video series providing a broad overview of the discipline of anatomy for these exams. So without further ado, let's go ahead and get started on today's content. I'd like to open up today by talking about McBurney's point. McBurney's point serves as a landmark denoting the base of the appendix, positioned at the intersection of the lateral 1/3 and medial 2/3 along a line connecting the right anterior superior iliac spine with the umbilicus. It assists in locating the appendix during clinical examination. I have a picture representing McBurney's point here. As you can see, it's 2/3 of the way from the umbilicus to the anterior superior iliac spine. Moving on. Next, I'd like to talk about volvulus. Volvulus occurs when the small intestine or sigmoid colon, due to its significant mobility, twists around its mesentery. This twisting motion can sometimes resolve on its own, but in other cases, it may persist until it completely cuts off the blood supply to the affected portion of the intestine. Moving on. Hirschsprung's disease. Hirschsprung's disease is a rare congenital anomaly which leads to intestinal obstruction due to impaired intestinal function. It is often associated with Down syndrome children. The condition arises from a segment of the intestine lacking ganglion cells, resulting in inadequate motility and the development of megacolon. Newborns with Hirschsprung's disease typically exhibit signs such as failure to pass meconium stool within the first 1 to 2 days after birth, feeding difficulties, bile-stained vomiting, and abdominal distension. Treatment typically involves surgical removal of the aganglionic portion of the colon. Moving on, let's go ahead and take a look at some questions. We have a newborn infant who presents with failure to pass meconium stool within the first 48 hours after birth, accompanied by feeding difficulties, bile-stained vomiting, and abdominal distension. Which of the following conditions is most likely responsible for these clinical manifestations? Alright, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. The clinical presentation described, including failure to pass meconium stool within the first 1 to 2 days after birth, feeding difficulties, bile-stained vomiting, and abdominal distension, is characteristic of Hirschsprung's disease. This congenital anomaly results from the absence of ganglion cells in a segment of the intestine, leading to impaired motility and the development of megacolon. The association with Down syndrome children further supports this diagnosis. Surgical removal of the aganglionic portion of the colon is the mainstay of treatment for Hirschsprung's disease. Therefore, the correct answer is C, Hirschsprung's disease. Let's go ahead and take a look at why the other answer choices are incorrect. Intussusception involves the telescoping of one segment of the intestine into another, typically seen in pediatric patients but less common in newborns. The clinical presentation of intussusception typically includes sudden onset, colicky, abdominal pain, and a palpable abdominal mass, which are not described in the case presented. Malrotation of the intestine refers to abnormal rotation of the intestine during fetal development, which can lead to volvulus and intestinal obstruction. While malrotation can present with symptoms of intestinal obstruction, it is less commonly associated with the failure to pass meconium stool and bile-stained vomiting seen in Hirschsprung's disease. Cystic fibrosis is a genetic disorder that affects multiple organ systems, including the respiratory and gastrointestinal systems. While cystic fibrosis can present with meconium ileus in newborns, it typically involves other symptoms such as respiratory distress and pancreatic insufficiency, which are not mentioned in the case presented. Pyloric stenosis is a condition characterized by hypertrophy and narrowing of the pyloric sphincter, leading to projectile vomiting in newborns. While pyloric stenosis can present with vomiting and feeding difficulties, it does not typically manifest with failure to pass meconium stool or abdominal distension as described in the case presented. Moving on to the next question. We have a 45-year-old male who presents to the emergency department with severe abdominal pain and distension. Imaging studies reveal a twisting of the sigmoid colon around its mesentery. Which of the following best describes the condition affecting the patient? Alright, I think I gave you guys enough time there. If you need more time, please feel free to pause the video. Otherwise, moving on now. Volvulus involves the twisting of the intestine, often the sigmoid colon, around its mesentery, resulting in obstruction and potential compromise of the blood supply to the affected segment. This condition typically presents with severe abdominal pain, distension, and signs of bowel obstruction. Prompt diagnosis and intervention are crucial to prevent ischemia and necrosis of the affected bowel segment. Therefore, the correct answer here is C, volvulus. Let's go ahead and take a look at why the other answer choices are incorrect. Intussusception refers to the telescoping of a segment of the intestine into an adjacent segment, typically seen in pediatric patients. While it can also lead to bowel obstruction and compromised blood supply, the description provided in the question aligns more closely with volvulus. Appendicitis involves inflammation of the appendix and typically presents with right lower quadrant abdominal pain. It does not involve twisting of the intestine around its mesentery. Diverticulus is an inflammation of the diverticula, small pouches that develop in the colon wall. While diverticulitis can cause abdominal pain and bowel changes, it does not involve twisting of the intestine around its mesentery. Colonic polyps are growths that can develop in the colon lining. While they can lead to complications such as obstruction or bleeding, they do not involve twisting of the intestine around its mesentery as seen in volvulus. Go ahead and move on to the next question. During a physical examination, a medical student identifies a specific point on the abdomen as a potential landmark for locating the base of the appendix. Which of the following descriptions best defines this point? Alright, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. McBurney's point is a crucial landmark used to identify the base of the appendix during clinical examination. It is precisely positioned at the junction of the lateral 1/3 and medial 2/3 of a line drawn from the right anterior superior iliac spine to the umbilicus. This location facilitates the localization of the appendix, aiding in the diagnosis of appendicitis. Therefore, the correct answer is B. It is located at the intersection of the lateral 1/3 and medial 2/3 of a line extending from the right anterior superior iliac spine to the umbilicus. Let's go ahead and take a look at why the other answer choices are incorrect. A. This choice inaccurately describes the location of McBurney's point. McBurney's point is situated along a line from the right anterior superior iliac spine to the umbilicus, not from the umbilicus to the right anterior superior iliac spine. McBurney's point does not correspond to the meeting point of the right external oblique muscle and the rectus abdominis muscle. It is specifically defined by its location along a line from the right anterior superior iliac spine to the umbilicus. McBurney's point is not located midway between the xiphoid process and the umbilicus along the midclavicular line. Its position is determined by a line extending from the right anterior superior iliac spine to the umbilicus. The description provided in this choice does not accurately identify McBurney's point. McBurney's point is not determined by the intersection of the transpyloric plane with the mid-axillary line, but rather by its position along a line from the right anterior superior iliac spine to the umbilicus. Guys, that will do it all for the video today. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. If not, this is FixerMed signing off. Also, would appreciate it if you guys could like and subscribe to the channel for more content like this. But that's all I have for the video today. Goodbye, good luck studying, and yeah, that's all I have.